Hi, I'm Madeleine Chace, and today is July 15th, 2014, and in a few weeks I will be turning 65. Needless to say, I was bombarded with information in the mail this year, which totally confused me even more. So I did some calling around, and I found a program called Shine. And along with that came a nice lady named Bessey, who was kind enough to drive into our New Bedford studio today from Middleborough to enlighten us on the ins and outs of Medicare. So welcome, Mary.
Well, thank you, Madeleine. Nice to meet you.
Nice to meet you too.
Yes.
So where should we start?
Where should we start? So you got a bunch of mail.
I did.
You did.
I did.
First off, I want to say that I am the regional director for the Shine program. Shine means serving health insurance needs of everyone. That's everyone that has Medicare, not just everyone that needs insurance, but it's anyone that has Medicare.
Okay.
So for instance, you're turning 65, you get all this mail, you're not sure what direction to go in, what do I need? Well, of course, the first thing you had to do was contact Social Security to sign up for Medicare. And the time to do that is when you're turning 65, either the month of your birthday, 3 months prior, or 3 months after. That's the window that you have to apply for your Medicare. Now there's other ways to get Medicare. You may be still working at the age of 65. If you're still actively working, you don't need to pick up part of Medicare, okay? Because Medicare does have two parts. Do you know what those two parts are?
Part A and B and Part D.
Yep, well, Medicare itself is just A and B.
Okay.
Okay?
Yeah.
D is something special, something separate. So your Medicare is your little red, white, and blue card.
Right, which is
there it
one.
is.
Yeah. And this is the little card here, so I can just take that off. This is what I carry with me, and the rest goes in my files. Yeah, and I'm on Social Security, so they sent me this automatically.
Automatically.
Right.
If you start collecting your Social Security at age, say, 62, Social Security, they already know that you're collecting, so they're automatically going to send that to you. But if you're not collecting Social Security, you're going to need to contact Social Security to apply for Part A and Part B. Okay?
Okay.
You can get
So
Part
put
A.
that aside.
You always get Part A. That's free. Part B is not free.
Right.
Do you have an idea of how much that costs?
There's a list of how much you make. If you make below $85,000 a year, it's $104 and some
90 cents.
90
correct.
cents. Comes out of your Social Security.
Absolutely. And that's monthly. And that's the Part B of your Medicare, because Part A is your hospital coverage, okay? Part B is your medical. So one way of looking at this is, with the Part B, it pays 80% of all your medical needs. So for $104 a month, you're getting 80% of all your medical needs taken care of, whether it's a doctor's visit, x-rays, labs, MRIs. Of course, if you were to have an MRI, 20% of that you're responsible for, which could be pretty hefty. So as Shine, what we do is we sit down and we look through different insurances that you may be eligible for, or kind of what best fits your pocketbook. There's just many things to choose from. There's like two sides of the page. Before I get started, I did want to say that as a regional director, there are 14 of us in the state of Massachusetts, and I cover the Plymouth County area, plus the New Bedford area, which I'm thrilled to be in New Bedford today. And we have counselors in all the senior centers. We also have a counselor at the Immigrants Assistance Center. We have 2 there. We cover different languages. We also have Shine counselors in Dartmouth, Fairhaven, and Acushnet. So if anyone out there is in any need of whether they're turning 65 or getting ready to retire, please notify your Shine counselor at your closest senior center.
Now, it's mandatory that you get on Medicare, right?
If you don't get on Medicare when you are eligible, you will be penalized down the road when you need it. Yes.
Oh, okay. So people out there, if you're watching, we're going to put all the numbers and addresses across the bottom of the screen so that you can watch this, and make sure that you tell people that you know, if they haven't seen this. We'll be running the show quite a bit in the next month, to watch all the way to the end of the show if they don't catch it, and we'll have all the numbers and the addresses and anybody that you need to contact to get help for Medicare on the screen.
Great.
Yeah.
Great.
We need to do this.
We need to do that.
It's so confusing.
Yes.
Tufts and AARP. I went to see a program, a person, her name was Pam Amaral Lima, and it was on Hillman Street.
Correct.
And she helped me. She helped me. Hi, Pam.
Yeah. Hi, Pam.
Yeah. She helped me out, and it's free.
It is free.
It's free. People
It is a
don't
free
realize
service.
that.
Yes. I also want to mention that someone could be under 65 and if they're under 65 and have Medicare, that means that they're disabled. Okay,
Right.
because if you're disabled for 24 months, you're automatically going to be eligible and receive Medicare. And again, that's when you'll want to contact a Shine counselor
Yeah.
so that we can help you through that
Yeah.
to see what you're eligible for, because there are different programs that we look at.
Now, what about the prescription?
Prescription is another part. That is your D. You've heard of A, B, C, and D of Medicare. Well, A and B is your Medicare. D is D for drugs. It's your prescription coverage.
D
and
for drugs.
D
That's
for
good.
drugs. What's really, really important about the prescription coverage is there's 31 plans to choose from. And what I
Wow.
tell everyone is where not to get a plan. And that is not from those lovely commercials on TV.
Right.
And not from your best friend or your neighbor or your brother or your sister, because
That's why we're doing this
this
show.
is why we're doing this, because so many people tend to pick up a drug plan because they may think it's the only one out there. What we do is where there are 31 plans to choose from, they're all based on the pharmacy that you use and the medications that you take. So depending on what medications you take to what plan best fits your pocketbook.
Right. So it all revolves around what your pocketbook
Oh, that's what we
says.
do. We want to save you money.
Yeah.
Not all plans cover all medications. And some of these plans have contracts with pharmacies. So what we want to do is, for instance, say your medications are generic.
Yeah.
Okay. So what we want to do is we're going to screen your drugs, your meds, through Medicare.gov. We're going to come up with a plan, and we're going to ask you what drugstore you use. You may use a drugstore that doesn't contract with the pharmacy that you use. I mean, you may have a pharmacy that doesn't contract with the drug plan that we're looking at. So what I'm going to do is I'm going to ask you, gee, do you know if you go to XYZ pharmacy, you could get your generics free.
Oh, there you go.
So this is something we look at when we're Shine counselors, because why go to the drugstore and pay $6 maybe for a prescription coverage when you've just switching a pharmacy may get you that prescription for free. It doesn't always work, but 99% of the time it does.
Yeah. That's a really good thing.
Right. Can I mention one more thing about the prescription drug plans?
Absolutely.
They need to be checked every year. You've heard of open enrollment?
Yeah.
Okay. Open enrollment is between October 15th and December 7th, and that is the time you need to contact your Shine counselor.
Okay.
Okay, and let us run your meds, because every year these 31 plans, they change their formularies.
Wow.
And some of the plans may have a deductible as high as $310. Okay, and it might be tough for you to have a plan with that. So we want to make sure that that each year we're choosing a plan that best fits your pocketbook, because they do change.
So the best thing is to go to a Shine counselor.
Always.
Yeah. That's really important that our viewers know that, because they don't realize that.
No, they don't.
They have no idea that they can get this information for free.
Exactly. It is free. and I'm just going to give you a little example of what's happened this week. Is we did get a call from someone who has Medicare, great thing, but never picked up a prescription plan. And this particular person is in their 80s, and they didn't pick up a prescription plan when they were eligible. So now they have a penalty because all of a sudden, now they've gone to the doctors and they're being prescribed medications.
Right.
The penalty is going to be an extra $35 and change on top of that premium because they hadn't picked a plan when they were eligible to get one, when they were eligible for Medicare. That's how important it is.
So every year in October
is when you can change your plan.
Change it, but when you get on at 65, you should
get a plan.
The plan, okay.
And what we do is we look at the least expensive plan for you.
Right.
Because if you don't take any meds, why pay more than you have to?
Right. But then if you, suppose you get really sick and you're taking a lot of meds, what's going to happen if you didn't pick up Plan D or what?
Well, and then you'll have to get one, but you can't just pick one up out of the blue. So what we do as Shine Counselors is we look at two things. We look to see if you're eligible for what's called extra help. It also has another name, limited income subsidy, based on income and assets. For instance, if you're a single person and your income is $1,479 or less, in assets, meaning money in the bank, IRAs, things like that. If your assets are less than $13,440, you're eligible for this, which would allow us to pick up a drug plan outside of open enrollment.
Oh, good.
Okay, so that's a good thing. We look there. We don't just say, well, sorry, you have to wait till open enrollment. There's one other way to pick up a drug plan outside of open enrollment, and that's with what's called Prescription Advantage. It's not a prescription plan, but it's an assistance program through the state of Massachusetts. What that does is, if you become a member, it's based on income. They don't care what you have for assets. It's income only. If you're eligible for that type of program, which does have a high income base, that would allow you to pick up a plan once, anytime, during the year. But it will also help you if you hit the donut hole.
What's the donut hole? The
donut hole. It's not the little donut holes you get at Dunkin'. It's not that. Well, it's when the retail value of your medications reaches $2,850. So, for instance, every time you go to the drugstore and maybe you're paying $10 for a prescription, but the retail value of that medication might be $100, okay? So every time you go, that's being added up. The retail value, 100 here, 500, whatever the retail cost is of your medication. And once that reaches 2,850, you've hit the donut hole, or it's also called the coverage gap. So the next time you go to the pharmacy, you're going to be paying 47.5% of that medication. So if it's that $100 medication, you're going to be paying $47.50 instead of $10. Oh, so you can imagine if you have a medication that's $500 or $1,000, you're paying almost 50% of that medication. So that hurts. So with this assistance program through the state, which is Prescription Advantage, you have to remember it's not a prescription plan.
Okay.
Once you hit that donut hole, Prescription Advantage is going to come in and they're going to pay that 47.5%. You won't have to pay it. They're just going to charge you a small copay.
Oh,
well, yes.
You have to get with a Shine person.
Everyone should have Prescription Advantage, just to be sure. Anything can happen down the road.
Wow. Is there anything else you can tell us? There's so much information.
There's a lot of information.
I know.
Let's see. Another thing we do when we have clients, when they come in, okay, let's start here. You come in, you have Medicare.
Yes.
Okay, so you're wondering, all right, what do I do? What do I have? So let's say we've already picked out a drug plan for you. So we know what pharmacy you're going to, we know what prescription plan you have. Now, you have another choice. You can pick out a supplement plan. because you need something to pick up that 20% that Medicare doesn't cover.
Wow, this is getting confusing.
Yeah. On the supplement side, they're also called Medigap plans. There's two types. There's a Supplement 1 plan, which I call Cadillac of Insurance.
Okay.
The state of Massachusetts has 7 plans to choose from. And what we do also as Shine Counselors is we look at the least expensive one. Only because why pay more than $200, say, a month for a plan if you can pay $175?
Right.
Okay? So right now, the least expensive one is $175.10. What that plan would do is pick up everything that Medicare, that 20% that Medicare doesn't cover.
Okay.
You can go to any doctor, you can go to any specialist, any hospital. You're in charge. These plans follow Medicare. They no out-of-pocket costs with those plans either, with any of the supplement plans. With the Supplement 1 plan, I should say. That's why I call it Cadillac of Insurance. If it's something you can afford, or if you're someone that maybe has a lot of medical issues and you go to the doctors, a specialist a lot, it's going to save you some money, okay? That's the Supplement 1. They also have what's called a core plan. That you can get for less than $100 a month, but what that doesn't cover is the $1,216 for your Part A deductible. See, Medicare has deductibles.
Okay.
Okay. If you were to go to the hospital for inpatient stay and you had just your Medicare, you're going to be responsible for $1,216.
Okay.
If you have the Supplement 1 plan, it's going to pick that up. If you have the core plan, it's not. Okay? Part B also has a deductible of $147. So the first time you go to the doctors during a year, you're going to be responsible for that first $147 if you have just Medicare.
Okay.
You pick up that Supplement 1 plan, it's going to pay that. You don't have to, okay?
Yep.
But if you pick the core plan, remember that one's less than $100 a month, you are going to be responsible for that $147.
Wow.
Yeah, it's a lot of information and
It's
it
a
can be
lot.
so confusing. But when you do sit with a Shine Counselor, we set it all out on the table. We really take our time, as much time as we need
Yeah.
to explain this to you.
Oh, Pam was wonderful when I
So,
went there.
yeah, so that's like one side of the page is what we call it, one side of the page. You'll have your Medicare, you have a separate prescription plan, and then you'll have your supplement plan. So let's set that aside because that can be kind of expensive. So on the other side, they're your Part C plans. They're your HMOs and PPOs.
Wow.
And there are 4 companies that sell those plans. With those plans, you're going to have out-of-pocket costs. And you're kind of setting Medicare, your Medicare card aside, because Medicare has kind of given these plans charge of you. Now they're in charge of you. They're going to tell you what doctors to see because not all doctors accept all those plans, the
And
Medicare Advantage plans.
Old people like their doctors.
So we want to make sure, it's very, very important that we help you. When we help you do this, we'll help you check with your physicians to what plans they choose because they have their networks. You're not going to be able to go just anywhere you want.
Right.
You're going to pay a smaller premium every month, but you're going to have out-of-pocket costs, maybe $20 for your primary, maybe $40 for a specialist. There's just a lot to that.
There is a lot.
Yeah, yeah.
Boy,
But-
you're really helping me today.
Am I?
You are.
It's a lot
because
of information.
It's a lot of information, but you're making it more clear that there is help there, so you don't have to remember all this information.
Exactly.
Yes.
Exactly. And I do want to mention too, there are a lot of other programs out there that someone could be eligible for, and it is based on their income. We might be able to get that Part B premium, which is $104.90 every month. We may be able to get that taken care of for you, and in that case, that's an extra $100 in your pocket every month.
Well, explain that a little bit. Now, what's the cap? What's the amount of money where they say you don't have to pay the 104.
Okay. If you're a single person and your monthly income is $1,333 or less, and your assets are $7,160 or less, this is for a single person, you're eligible to have that taken care of.
Oh, that's good.
Isn't that good?
That's good.
Yeah.
Because you're very low income at that point, so you can't really take that
So
100.
many people, yeah. Their monthly income could be $1,200, and I mean, that's an extra $100 in your pocketbook is a lot for someone.
Now, if you're making that amount, would maybe your prescription plan be taken care of too?
Well, if we know that that's your income and it's less than that, we know that we can also get you that extra help I talked about.
Oh, that's good.
That's the extra help that'll take care of help pay the premium and your co-pays at the drugstore.
And there's also other plans I know out there that we don't know about as the public, and that a Shine program person would pick up on it and say, well, maybe you're eligible for food stamps.
Absolutely.
Do you know that?
Food stamps, fuel assistance. As Shine counselors, we're not trained in that. Some of our Shine counselors are, because they've been maybe sent for training, Shine training, from the senior center. They might be an outreach person, or maybe even a director. We have a few directors from senior centers that are also Shine counselors, took the Shine training. And that's who we would send you to, because that's another thing that we do as Shine counselors, is we kind of look at the whole picture. We look to see what all your needs are.
Yeah.
You may have a spouse at home that might be a little disabled. You might need help at home, or maybe you're now taking care of your mom or your dad and need help. And what we would do in the New Bedford area, we would have you or help you contact Coastline Elder Services.
Now, that's where people would contact.
Yeah, we would contact them.
That's on Hillman
That's
Street?
on Purchase Street.
On Purchase Street.
That's on Purchase Street, Coastline Elder Services. And they would send someone out to assess. To see.
They send people
They
to your
would send
house.
someone to your home.
That's very
to assess
helpful.
the elder, the person that may need, extra help, maybe in bathing or cooking or whatever the needs are. They also do money management. They really do a lot. But as Shine counselors, we know where to send people or where they can get this extra help.
So if you're out there and you say, I can't go out and see a Shine person, they'll come to your house.
All you need to do is call, and if you don't have a number handy,
we'll put that down on the bottom. We'll see the numbers, and at the end you can see the numbers again.
Right. I'm sure you've heard of the number 1-800-AGE-INFO.
No, I haven't.
You haven't.
1-800-AGE-INFO.
That's 1-800-243-4636. If you're anywhere in the New Bedford area or in Plymouth County and you dial that number, it's going to ring in our office at the Middleborough Senior Center. That's where our regional office is for that area. And if you live in another town, we're going to help you. We'll either help you over the phone or help you to get in contact with the nearest Shine counselor.
It's hard enough to turn 65. But to be bombarded with this is like overwhelming.
It's totally overwhelming.
It is.
It really, really is. And that's one reason I can't thank you enough for having me today.
Oh, I can't thank you enough for coming.
We need to let people know. We also have a Shine counselor at the Greater New Bedford Community Health Center.
And
Derek.
where is that?
I believe that's on Purchase. Is that on Purchase? Pleasant Street? Might be on Pleasant. I do have the address. I'd have to double check.
Okay.
I'll be sure to get you the right information.
And when I went to Hillman Street to talk to Pam, you could park right across the street. It's
beautiful parking.
It's perfect. It's the old vocational high school.
Oh, is that what it is?
Yeah,
Okay.
that's what it was. Because I looked, I said, isn't this Voc? It's the old Voc.
Yep.
Yeah.
Yeah.
She was wonderful. It was easy. She made it very easy for me, and you really need to feel comfortable because this is such change in your life. It depends on what kind of medical you've had before.
It does.
Everything changes.
We take that all into consideration. And another thing, I mean, there's just so many things that we do. Maybe someone's retiring from their company that they've worked for, and maybe they're being offered a retiree plan. we'll sit down and go through that, plus compare it with Medicare plans, just to see which one it best fits their needs and which one they can afford.
Yeah, my mother used to work for Tideless, and she has a small supplement from them.
Yeah.
Yeah.
And many, many times we'll say, you know what, keep your retirement plan because you're saving more money there.
Right.
So, but we do look at that.
Oh, that's awesome. The
Yeah.
ins and outs of Medicare. That'll be the title of this show, The Ins and Outs of Medicare.
And I can come back.
Yeah.
Sure.
This is great.
Yep.
Now, do you think there's any more information for our viewers out there?
There's
we need to tell
so
them?
much more that I
There
could really
is.
say. Yeah. I do want to mention that if someone also is eligible for Mass Health, we're the ones to see. We can help you with that. There's also another program out there that's called Health Safety Net, another one that's based on income, not assets, that helps to pay that Part A premium, or it can be used at your health centers.
Yeah.
You know, if those are the docs that you use.
I think people are a little shy about contacting people. They want to try to do it themselves.
They do.
But this is perfect. I mean, you don't. All you have to do is call, and they'll come to your house. If you're disabled and you can't get out.
We're here to help. And I see you have that Medicare and You book over there.
I do. This is what came first, I think. This is what came first. And I was like, whoa, what?
A lot of our phone calls come when people have received that because they've sat down and they've read it and they're like, what is it?
What? Exactly. I was very confused. And then all this.
Yes, look at all your papers.
Look at the papers. And I still get papers. And I'm turning 65 on August 5th. You can send flowers if you'd like. Well, I think that we've gotten a lot of information today that was so important. As a viewer, please take note of this. I'll be running this show all through probably July and August so that you can get help when you need it, or for someone that you know that's turning 65. I want to thank Mary.
Thank you. But don't forget, open enrollment.
Open enrollment October
15th to December 7th. You need to get that prescription plan checked.
So every year you call your Shine counselor.
Every year.
Ah, see, I'm sure people don't realize that.
And if you have the Medicare Advantage plan that has that drug portion with it, again, that needs to be checked during open enrollment.
Yeah, I'm a breast cancer survivor. I'm on quite a few different medicines and stuff. So this is so important for me to know what I'm doing.
Yes, I'm glad you found Shine.
I'm so, well, my daughter-in-law, Yvonne, she's an instructor at Health Tracks. And she was talking to some gentleman from Westport who was a Shine program person. I think he's not doing it anymore, but he's the one that got me in touch with you.
Yay.
And you were kind enough to come here today.
Thank
It's
you.
raining and a little misty, but
okay.
It's still summertime, and we're happy about that. Well, I think I'll be wrapping this up now, and thank Mary so much again for coming out. And if you're out there and you're turning 65, I'm going to say this again, or if you know someone, please have them watch this show. We'll have all the information that you need. You don't have to get crazy about it. And when you get all this information like I did, and that's why I'm doing this show, so that I'm not crazy anymore. I went to see my Shine counselor, and I'm on the track. I have to put my medications in, and she'll help me with that at this point. But I'm all set, and I want you to be all set out there, because I know 65 is, I don't mind turning 65, but we're getting older and we need help. And thank you for watching. This is Madeleine Chace. I'll see you later. Bye.